सब्सक्राइब कीजिए लर्निंग फार्मेसी चैनल को एंड बेल आइकन को दबाइए लेटेस्ट फार्मेसी वीडियो सबसे पहले देखने के लिए। In the end of this video, we'll ask you a question. You have to answer that question so that you'll get to know that you understand this video well or not. So by means of that, you have to communicate your answer in the comment section below. So let's get started. So in this video, we're gonna cover Pharmaceutics chapter 1.2 dosage forms of the drug, in which what topic we need to cover. We will cover the brief explanation of all the dosage forms. So in the previous video, in the previous Pharmaceutics chapter 1.1 video, we have discussed the classification of different dosage forms. So do check it out if you haven't checked it out till now. So first we have solid dosage forms. In that we will discuss unit dosage forms. Unit dosage forms are the dosage forms which we need to take one at a time. Like for example, tablets. Tablets come under unit dosage form. You will take one tablet at a time. So what are tablets? You already know tablets are the unit dosage form of medicaments which contain active ingredient and excipients. Active ingredient are the agent which are actually responsible for producing the desired effect for which you are taking that drug, and the tablet may vary. That also you know, the tablet vary in shape, size, weight, and hardness and thickness. We have seen that there are different kinds of tablet, different weight of tablet, different size of tablet. So these are the tablets that comes under unit dosage form of the solid dosage form category. Then it's other one we have capsule. What are capsule? Capsule are also the unit dosage form and containing gelatin shell. So capsule outer covering is made up of gelatin, and this gelatin shell, when you swallowed this capsule, this gelatin shell melted. This gelatin shell, you can say, break down, and the medicament release into the circulation. So there are basically two kind of capsule: hard gelatin capsule and soft gelatin capsule. Hard gelatin capsule, these are the hard gelatin capsule in which two pieces, you can see two pieces are fit together and hold the drug inside it. So basically solid and granular powders are filled inside this hard gelatin capsule. Whereas we have soft gelatin capsule, in which, see, these are the kind of soft gelatin capsule in which only one piece is available to swallowed by you, and there is no two piece. In hard gelatin we have two piece, in soft gelatin we have only one piece, and usually the liquid form of medication is filled inside this one soft gelatin shell. So these are called unit dosage forms. Now we'll continue with our unit dosage form. In that we have now powders. So powders, you have seen these kind of powder that you can take whole at a time, that are meant for one time use only. You have seen the Eno sachets. Not the Eno also come in bottle form, but we are not talking about bottle here because bottle comes under bulk dosage form. In unit dosage form we are talking about Eno sachets. You will take the whole sachet at a time, at one time. So that's why it's come under the unit dosage form category. Then pills, we have pills. What are pills? Pills are small rounded dosage forms containing medicaments. So these are the kind of pills, and that are meant for oral use. You have to take it orally, but nowadays pills are not that much in use. They are rarely used nowadays. Now we'll talk about, in solid dosage form we'll talk about the bulk dosage forms. So what are basically bulk dosage form? These are the dosage form which you can use again and again, multiple time you can use these kind of dosage form. In that we have powders. So what are powders are finely divided solid dosage form that are meant for internal and external use. You can use it internally for the laxative effects. Most of the people take it internally for the laxative effect by oral means, and you can use it externally for antifungal, antibiotic effect. You can see they are available in different form of dusting powder, cotrimoxazole powder, etc. So these are the dusting powder. So they are basically there are three type of bulk dosage form in that category. These are dusting powder, granules. See, these granules are this kind of dosage form that are available in this small granular form, and sachets. So we have already discussed sachets in unit dosage form, but there are some kind of sachet that are also available in bulk dosage form. So these are the dusting powders. Then we have insufflation. So insufflation, what are insufflation? These are the kind of medication by means of which we can blow. See, these are, we have seen, shown you the example how to blow. So by means of insufflation, you can blow gas, powder and vapor into the different body cavities. So these are the insufflations. Now in solid bulk dosage form, we have dentifrices. What are dentifrices? Dentifrices are the preparation including tooth powders and toothpaste that we will use along with the toothbrush to clean and polish our natural teeth. So these are sometimes these are the medicated preparation which is prescribed by the doctor for the particular action which is required on the patient teeth. So these are called as dentifrices. Now we will see that liquid dosage form. In that we'll first see the monophasic liquid dosage form. In that we have elixirs. What are elixirs? Elixirs are the solution that contain alcohol and water. So you can see that alcohol is present in the elixir and it has got a water base. And what else it contains? It contains sugar and flavoring agent. And elixirs are commonly prescribed to the pediatric and elder patient who can't take capsules and tablet as whole. So doctor who have difficulty in swallowing the tablets and capsule, so doctor prescribe elixir to them. Then we have syrups. What's the difference between elixirs and syrup? So basically syrups doesn't contain any kind of alcohol. Syrup is a whole concentrated solution of sugar, water and flavors. And what else? Syrups are more sweeter and more viscous as compared to that of elixirs. Elixirs came in solution form, but syrups came under some kind. Syrups are some kind of viscous preparation. So that's are the difference between elixirs and syrup. Last we have linctus. What are linctus? These are the thick liquid medications that are basically used to treat the dry cough situations. So these are three monophasic liquid dosage form. Now in monophasic liquid dosage form we have drops. What are drops? Drops are the solution that are prepared by dissolving one or more solute into the solvent. And you can see you have to make sure that while making a drop, the pharmaceutical companies make sure that there is no sign of dispersed particle into that drops. Because why? Because drops needed to be instilled in different body areas like eye, ear, nose and oral drops. So no suspended particle has to be seen inside this solution form. Now we will see the liquid dosage form, biphasic liquid dosage form. So we have seen that in monophasic liquid dosage form there is only one phase present, there is no two phase present. But in biphasic liquid dosage form we have two different kind of phase that are present into the medication, as the name indicate, biphasic. So first we will see the emulsions. What are emulsion? Emulsion are the dispersion system that contain two immiscible liquids. So there are two kind of emulsion. One is oil in water and the second one is water in oil. In oil in water kind of dispersion kind of emulsion, we have oil, see the yellow spot, oil as a dispersed phase and the water as a continuous phase. And in water in oil we have water as a dispersed phase and oil as a continuous phase. So the most common example of emulsion is cod liver oil emulsion. So these are the emulsions. Now we have suspensions. What are suspension? These are also the dispersion system that contains solid particle and liquid phase. So we have seen in emulsion contain two immiscible liquid phase, but suspension contain two immiscible solid and liquid phase. So that are the difference between emulsion and suspension. The example of suspension is most of the injection available in pharmaceutical industries in pharmacy are made in the form of suspension. So if you keep that suspension bottle for the longer period of time, these kind of precipitate start forming at the bottom of the container. So you need to shake it well before using. Now we will see the semi-solid dosage form. In that we have internal and external. First we'll talk about internal semi-solid dosage form. So first example is suppositories. What are suppositories? Suppositories are small rounded cone-shaped objects. See, these are the kind of suppository that are generally kept into the body cavity of the patient, usually in the bottom, usually on into the rectum. These are supposed to be inserted or supposed to be delivered. So once it goes inside, it start melting and dissolving, thereby releasing the medication to the circulation. So these are the examples. Suppository. Now we have in semi-solid internal dosage form, we have pessaries. What are pessaries? Pessaries are small soluble blocks. See, these kind of the blocks we call as pessaries that are inserted into the vagina of the woman. So basically it is meant for women to treat any kind of infection if the women have into their vagina. So these kind of pessaries are used, or as a contraceptive measure, these kind of pessaries are used by the women's. In semi-solid dosage form, we have external semi-solid dosage form. The first example is ointment. What are ointments? Ointments are oil-based preparation that are usually applied onto the skin or onto the mucous membrane. The most common example of ointment is neosporin ointment that are typically used for treating the bacterial infections. Now we have cream. What are cream? Cream are the preparation that are meant for topical use only onto the skin. So so creams are usually applied onto the skin and that contain the water base. So the example of cream is hydrocortisone cream for skin irritation. These are some of the examples of this kind of categories which we are discussing. So the basic difference between ointment and cream is the ointment base of the ointment is oil. So ointment, we can say that ointment is an oil based preparation, but creams are the water based preparation because base that are present in the cream is water. So that you might have seen that cream can easily washed away with water if you want to wash cream onto the from your skin surface, but ointment doesn't get washed so easily. So this is the reason why, because ointment have oil based. Then we have paste and jellies. So paste and jellies are semi-solid preparation that contain one or more drug substance for topical application. And what is the difference between paste, jellies and the ointment is that in paste and jellies there are more amount of solid content that are present in paste and jellies as compared to that of ointment. So this is the difference between paste, jellies and ointment. Now we have other dosage form. In that we have gaseous dosage form. The example of gaseous dosage form is inhaler. What are inhaler? Inhaler are the preparations by means of which the finely divided powdered drug substance or the solution or the suspension of the drug can be administered into the patient by means of oral route or nasal route. Example of inhaler is salbutamol inhaler for asthma. Then we have aerosols. What are aerosols? These are the preparation in which the product or the medicament is kept inside this pressurized container, and by means of this nozzle it can come out and do the desired effect, produce the desired effect, as you can see in case of perfumes. And there are some of the aerosol packaging for relief, to get relief from the insect bites, etc. There's a question for you. A suppository is generally intended for use in, so there are the options: rectum, ear, throat and mouth. So basically they are asking that suppositories are basically used in which part of the body: rectum, ear, throat and mouth. Answer this question in the comment section below. So thanks for watching. In next video we'll cover Pharmaceutics chapter 2, packaging of pharmaceuticals. So friends, if you like this video, please hit the like button and share this video with your friends. If you are new to this channel, do subscribe our channel by hitting the subscribe button below. If you have any question, do leave a comment in the comment section below. So these are some of the links of the related videos. So friends, thanks for coming to the Learning Pharmacy channel and watching this video. We'll see you in the next video.